Good afternoon, and thank you for joining us for today's daily media briefing about COVID-19 in London and Middlesex County. Once again, we are joined by London City Mayor Ed Holder and the Medical Officer of Health for the Middlesex-London Health Unit, Dr. Chris Mackie. I'd like to welcome people who are watching through the CTV News London website at ctvnewslondon.ca. I hope I got that right, Steve. Maybe it's ctvlondonnews.ca. My apologies, but thank you for joining us here there. Also, the folks tuning in on Rogers Cable, also Rogers Facebook page and YouTube channel, as well as those tuning in on AM 980 CFPL, that's Global News Radio. We'll get to it right away, and I'll turn it over to London City Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan. Good afternoon, ladies and gentlemen. You'll know that some of you that I sit on the London Police Services Board. We just had our meeting yesterday through teleconference, as is the norm anymore, the new norm. And one of the things that our police chief was cautioning was now that streets are less busy, there seems to be a pretty significant preponderance towards speeding, and in particular, really serious highway level speeds and greater on some of our city streets. Here's the problem. It's not just that you're going to get ticketed and with a serious ticket, but worse than that, you're going to kill somebody. So if somebody thinks that's a really clever idea, we're just simply saying don't do it. We know the traffic's lighter. We know the roads aren't as busy, but it's not a speedway. So we're cautioning Londoners, as we do on different things from time to time, don't. And if you see somebody doing it, report it, and we'll get them. Because it's just not right. Second thing, by the way, shout out to General Dynamics Land Systems Canada. You may not be aware, they just issued a press release because they're donating 14 ventilators and 860 N95 masks to London Health Sciences. Interesting, this personal protective equipment was originally intended for their own internal lab ambulance variants. But they've determined that the need is greater today in the hospitals. So while we know that GDLS supports Canadian soldiers on the front lines with their vehicles, now they're supporting healthcare workers on the front lines in the fight for our lives. So GDLS Canada, well done. A Canadian head office right here in our city. Third, just more of a public service comment. I've had some inquiries about, can we cut our lawns and what about services that can cut our lawns and grass maintenance? It may seem like a little thing, but nobody intentionally wants to break the rules or do anything wrong. So they ask us these kinds of questions. So I just thought I'd quickly tell you that any business that's involved in lawn cutting or dethatching, rolling, or clearing yards and garden debris or aerating the soil, those are all allowed. Just so you know, they're allowed. But what are not allowed are landscaping projects that are to beautify or are just for aesthetics. Those are not allowed. And if you do that personally, you know that, again, the lawn cutting and the like works. And if you're looking for more information, go to our website at london.ca, and that will give you the do's and don'ts, because I know people are looking to do it the right way through this pandemic, and we appreciate all others. So that's just a brief scan of just a few quick items, and I'd like to turn it over to my friend, Dr. Chris Mackie.
Thank you, Mr. Mayor. So, quick overview of the numbers: 24 new cases in Middlesex and London over the past 24 hours, and 564 new cases at the province. That provincial number is the highest number we've had yet, and the local number is quite high. So this is really the high point of this epidemic. We are very much deep into high disease transmission, and it's more important now than ever that we respect public health measures and physical distancing measures. Aside from numbers, I want to make sure that everyone on the media and the public is aware the Middlesex-London Health Unit is taking new steps to improve transparency of our work. Because our meetings are all being held, the Board of Health meetings are being held online now through Microsoft Teams. We are now able to record those meetings, and later this afternoon, for the first time, we will be posting a video recording of the Board of Health meeting last night. So if you're interested in some of the reflections on how our new location at City Plaza has really facilitated our great work on coronavirus, or on what the update as to what is happening on coronavirus at a technical level, please do check that out. It should be up within the next hour or so. That's it for me today. Thanks very much.
All right, thank you both, Dr. Mackie and Mayor Holder. Dr. Mackie, we're going to get to the questions, and the first one is for you. And the media received the media release that was issued a short while ago by the health unit about the 14 new cases being reported at Grandwood Park retirement residence. So the first question is from Steve Young at CTV News. When did the health unit become aware of the outbreak at Grandwood Park, and what measures are being taken to deal with it both inside the home and with employees?
So yesterday, we became aware late yesterday of the new cases at the 14 new cases at Grandwood. The outbreak had been declared about 2 weeks prior. At that time, there were only 2 cases, and that was enough to declare an outbreak. The health unit went in to ensure that everyone who was in contact with those 2 cases, as well as anyone else in the area with any kind of symptoms, was tested for coronavirus, and also to make sure that the home had all appropriate protocols in place, including personal protective equipment for staff, masks in particular, so that we could significantly reduce the risk that staff might be transmitting the virus to residents. The outbreak was contained for some time due to the hard work of the staff at Grandwood. We're now unfortunately seeing additional cases, and what this triggers for us is now a whole new round of testing, so that everyone in that facility now, whether they have symptoms or not, will be tested.
Very good. Thank you very much, Dr. Mackie. And there was another question about ventilators, but that is a question that would be best addressed, I believe, by London Health Sciences Centre. Next question, also for you, Dr. Mackie. This is from Andrew Lupton at CBC London. Just wanted to confirm that the total number of cases at Grandwood is now 14, because, as the release states, there was at least 1 case from when an outbreak was declared there March 31st.
Yes, so there were actually 2 cases diagnosed essentially at the same time, March 31st. The provincial case definition now requires only 1 case. We had 2 come in at the same time, and that's when the declaration of the outbreak was made. The 14 cases announced today are new cases in addition to the 2, so they're now a total of 16 cases there.
All right, thank you very much, Dr. Mackie. We have another question from Andrew Lupton about how outbreaks are reported. It appears that once an outbreak is reported at a facility, subsequent confirmed cases at that same facility are not updated. We know, for example, there are multiple cases at another home that currently is listed on the outbreak report. The question is, why isn't the health unit giving comprehensive information about positive cases at specific facilities? Why not list the total known and confirmed case numbers at all facilities?
So the public health mandate with personal information and information about facilities is that we are empowered and required to share that information when there's a clear need for that information that can help protect the public. In this situation with Grand Wood, we feel that that is a test that has been met. But in any facility where there has been an outbreak declared, anyone who is involved with that facility should be taking that seriously and taking all due precautions to protect themselves. So in an average situation, we wouldn't necessarily update the media directly. That said, we do have a daily outbreak report that is now available publicly. That report has been published every day for many, many years, certainly well over a decade, and is sent daily to all of the homes in the region and other healthcare providers that would be interested. That report is now being made available to media as well because there has been such interest in these sorts of cases, and that would be the place to look for the sorts of updates that you're looking for. If you need information to get a hold of that, daily report, please do reach out to Dan, and he can help you get that.
All right. Another question, follow up from Andrew, and it relates to the testing going on in homes where outbreaks have been declared. So are all other homes with an outbreak being tested, and when do we expect to have those results?
Yeah, so the province has expanded testing criteria significantly, which really helps us to manage those outbreaks in homes. And essentially what we're doing now is as soon as there is a positive in a home, everyone on that unit gets tested. So one case of coronavirus, we're now testing all staff and all residents in that unit, as well as anyone else that may have been in contact, whether a visitor or otherwise, although visitors are really quite restricted at the moment. So that's the sort of the wraparound for that one individual case. In a facility that has many floors or many units, that might when one test positive would not generate testing for every unit, but certainly everyone that is on that unit. Now, if you, in those situations with many units, if there is a case outside of the original outbreak unit, then we would then go ahead and test everyone in that facility, regardless of which unit they're on, staff or resident.
Okay. Dr. Mackie, this is also about Grand Wood Park from Dan Brown at the London Free Press. Actually, this is a pretty simple question. Is Grand Wood Park a retirement home or a long-term care home? Go ahead.
Not at all, Dan. I mean, you wrote the press release, so you could probably answer this one. And correct me if I get it wrong. I believe it's a long-term care home, isn't that right?
It is a retirement residence.
There you go.
So it's a retirement residence.
Thank you.
You're welcome.
It's a really interesting discussion we've been having on long-term care homes and retirement homes. They're really on a spectrum, and the definition is really a legalistic one, which doesn't always translate directly into risk. Long-term care homes are places where you generally have a higher level of illness, and you generally have a higher level of staffing as well. And that combination means that it is really a balance between the additional needs versus the additional resources that determine whether the facility is relatively high risk compared to other facilities. And so that's why the Middlesex-London Health Unit is now, as we speak, doing a risk assessment on every long-term care home and every retirement home in our jurisdiction. We're actually using the medical student support that we have for this and reaching out to each of those homes to make sure that they have best practices in place, that they have access to the personal protective equipment they need, that they're able to do the cohorting so that staff aren't working at multiple facilities, that they're able to access swabs and get testing done whenever needed. That risk assessment we hope to have done within the next couple of days, and then going in to support those homes that are deemed to be high risk based on that risk assessment. What we're seeing in some places in Canada is that the squeaky wheel sometimes gets the grease, and it might be some of those wheels that are not squeaking at the moment that need the grease most. And so we're going out into checking in an objective way who does need that support the most. Huge support for that across the healthcare system. The leadership of our local hospitals, our local primary care providers, the Ontario Health West region, all very keen to make sure that those homes get the support that they need and doing everything they can to free up resources to do so, including in some cases moving staff out of long-term care into hospitals.
Thank you very much, Dr. Mackie, for that answer. If we do have questions from the media, we would love to hear from you. We've got a couple more in the queue, but there is time for a few more. We are going till 2:30 this afternoon. And if you have questions for Mayor Holder as well, if you could just indicate that in your question. But right now, the questions, Dr. Mackie, seem to be focusing around the announcement at Grandwood Park today. And we have another one from Steve Young at CTV London. With the increased testing that's being discussed, do you expect more positive cases at long-term care homes in London and Middlesex County?
Yes. This is really where the battle of coronavirus is happening. We're seeing the number of cases, severe cases certainly, and deaths in the community declining, and the number of significant cases and mortality in those homes, those congregate settings, is increasing. And so that's where we're really focusing our attention now. Those numbers certainly will continue to increase, but the public health and healthcare systems all together are doing everything possible to support the people working and living in those homes.
Thank you very much, Dr. Mackie. I did want to mention we just got a question through email, and I just wanted to mention for the media who are looking for the outbreak status report that is published on the Health Unit website, if you go to healthunit.com/novel-coronavirus, you probably have that bookmarked already. If you scroll down the page, you will see just below the case count boxes, you will see the link for the outbreak status reports for London and Middlesex County. So just wanted to point that out for the folks who are looking for it. All right, another question for you, Dr. Mackie. At Grandwood Park, are all 14 cases residents of the home, or does that number include staff? Are they being treated at the facility? How many have been hospitalized? And I know some of that is information that you may not have right at your fingertips.
Yeah, from what I've been told, the 14 cases are cases that are in the residence. The next question also is related to the 14 new diagnoses, and at least one of those individuals has had to move into hospital at this point.
Okay, so that would also, I think, answer the next question that Steve Young has. He was asking if all 14 residents at Grandwood are still at the residence, and as you mentioned, one of them, it appears, has been moved to hospital. Okay. All right, gentlemen, we actually don't have any questions right now in the queue. So if we have media who are watching, it'd be a great time to send those questions in. As we take a moment to let those come into the system. I wondered if we're hearing from people that they're starting to get, and you mentioned this a little bit, Mayor Holder, they're starting to get tired of all of this and are really looking forward to what's next. And I wonder if you've got that message to tell those people, to encourage them to keep going, what would that message be?
Well, one of hope, one of keeping your family close, even if it's by teleconference or phone, but not necessarily by visit. Look, as the weather gets better, and we're going to have a little bit warmer weather this weekend, albeit perhaps not so sunny, but the reality is that we have to keep our vigilance high. 24 cases is, I believe, the biggest number we've had in a single day in terms of diagnoses, and there may well be reasons why in terms of testing timing and the like, but it doesn't matter. We're at a serious level now. And I think everyone's vigilance is more critical than ever. So what we've been preaching from an education standpoint has been about self-distancing, going in singly to do your shopping. It isn't a family excursion anymore, nor are family visits and the like. People have worked so hard over the last number of weeks to keep themselves and their loved ones safe, and we're asking them to hang in a little bit longer. You know what? I literally have a crystal ball on my desk. That is true, but I cannot tell you when this will peak. What I can tell you, though, is that for all the efforts that people have done, it's not been wasted. It is important. You have a chance to save a life. Please continue doing that.
Thank you very much, Dr. Mackie. I wondered if you'd like to respond as well. We do have a couple of questions to get to, but a message that you have for folks to sort of carry them through the next little while.
The measures that people are taking, the distancing measures, the closures are all making a huge difference. We really saw the curve, the increased number of cases start to bend when people started to take those physical distancing measures seriously. And that's a huge credit to the people of our region in London and Middlesex. If you look around the world, that's not always the case. It has often taken months for countries to get a hold of this epidemic. And the fact that we've been able to do it already and that things are starting to level off means that people are really doing this right. We still have some ways to go, and we're still at our highest level of disease activity that we've been at through this entire pandemic wave. And so people need to keep it up, but there is light at the end of the tunnel.
All right. Thank you very much, Dr. Mackie and Mayor Holder. Back to the questions. This one, Mr. Mayor, is for you. It's from Dan Brown at the London Free Press. Mayor Holder, are you expecting another spate of fines being issued this weekend?
That has nothing to do with me. That certainly has everything to do with the activities of Londoners in the various parks and facilities. Look, we've got a call-in line to take pressure off the police, so you don't call 911, you call our special line or email it in with a concern if you have it. But clearly we're going to have our bylaw inspectors out just paying mind. We've educated folks over the last number of weeks, but they will be vigilant. They'll be vigilant in the parks and places where people might play basketball or skateboarding parks, or and the idea is we're not going to be sneaking up on people, but what we're going to be doing thoughtfully is we try to educate, but on the other hand, with those who don't want to listen, there are other options. So will our enforcement people be out? Absolutely. And they're not just out, so you know, on weekends. They're out every day, because now as a result of of so many people being home, there are more opportunities for people to go to public places, and that's the cautionary here. The comments Dr. Mackie has made that we echo every time about self-distancing, just doing the practices and habits, the new habits that we've asked people to undertake, matters in saving lives. We're saying to people, do it, and we'll have our bylaw enforcement folks there just to encourage that a little bit more.
All right. Thank you very much, Mayor Holder. A question for you now, Dr. Mackie. This is coming from Sawyer Bogdan at AM 980 CFPL Global News Radio. Dr. Mackie, the health unit release on Grandwood Park mentions they'll be conducting risk assessments of all retirement and long-term care homes in the region. What do those risk assessments entail?
So these risk assessments are really about process, resources, training, equipment to make sure that the homes have what they need to protect residents. Some examples of the questions, I've got the tool in front of me, but there's a question here about does this facility have a designated infection control professional to support them? Does the facility have occupational health and safety representatives to support them? Is the facility implementing the province-wide protocols and procedures? Does the facility have an up-to-date assessment of their residents' needs? These are the sorts of things that when we understand better, what are the processes, protocols, equipment, supplies, staff training, and staff resources relative to the needs of the residents, it'll give us a much clearer picture of which homes are in good shape and which ones need additional support.
All right. We have another question that's just come in, Dr. Mackie, and this one is also for you from Andrew Lupton at CBC London. The health unit went public with Grandwood cases today, but we're hearing about another long-term care home in London with more than 6 current cases. How many confirmed cases does it take to inform the public about confirmed cases at specific facilities?
Yeah, this is a good question. I understand why you'd ask, and also it's part of the art of public health, where it's really about adequately communicating risk to the public so that the public can make informed decisions. And so a situation where there are 6 or 7 cases that might have come on over a month or so, it's not as concerning as a situation where you've diagnosed 14 new cases in one day, and that really changes what we're seeing in our homes locally. We've had outbreaks. We've had 9 outbreaks as of yesterday that were active in the region, and so outbreaks are not anything new. It's this real proliferation of cases in one specific facility all at once that is a sign that things are changing in the field, and we felt it was crucial to notify the public about that situation.
All right. Thank you very much, Dr. Mackie. Thank you, Mayor Holder. We're almost out of time, and we are out of questions. So I think we'll just see if there's one that may squeeze in here before the end. But again, a reminder that we will be back with our daily virtual media briefings on Monday. So once again, the media are invited to join us at 2 o'clock, and you can submit those questions right in the question and answer box on the Teams window, the viewing window. Again, a thank you to everyone who has been tuning in on AM 980 and also through the CTV London website, as well as on Rogers Cable, Rogers Facebook, and also on the Rogers website. I think that takes care of the questions for today, gentlemen. So for a Friday afternoon, I think we'll end it right there, and we'll see you both again on Monday.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
My experience with Rogers TV has been great. Everyone's really nice and helpful. When you don't know how to set up a piece of equipment, they'll help you. People should volunteer for Rogers because it's just a great opportunity to get practical, hands-on skills in the TV industry. The most important skill I've learned with Rogers is graphics, because before I did Rogers TV, I didn't have an opportunity to do graphics on a live show like this, so Rogers has really helped me out a lot.
After a night out with your friends, not having a plan for a safe ride home can leave you in a bad spot. You could end up riding in a police car, an ambulance, or a hearse. These unplanned modes of transportation can be a costly choice and do not take you home. Your plan could include a designated driver, a taxi, or public transit. Drink responsibly, choose your ride, and have a plan for a safe ride home.
Visit arrivealive.org to find out more.
You're watching Rogers TV.